Oscar. My name is De Martinez. I'm a nurse practitioner student with Maryville University. Would it be okay if I do your head-to-toe examination today?
Yes.
Okay. So I see that you're sitting relaxed and comfortable. Would you like to change into a gown? There's some areas of the exam that I have to expose your skin.
No.
No, you're comfortable. Okay, how about, do you have to go to the bathroom and empty your bladder?
Not at this time.
Okay. Let's go ahead and get your weight and your height, please. Okay. 160. Excellent. Now with your... Okay, so 5'9". Okay, good. You can go ahead and sit down again. I'm gonna start with your vital signs. Okay. Good. It's 115/60. Okay. Next, I would like to take your temperature, and I'm going to take your pulse. I'll do it here. Okay, 98.6, perfect, normal. Okay, so your heart rate is regular and strong, about 80 beats per minute. While I was doing your pulse, I also took your respiratory rate, which is 16, which is very, very normal. Okay, we're gonna start, I'm gonna start with your head and your face. We'll take a general inspection of your skull, which is round and smooth, no obvious lesions or abnormalities. Your skin is even toned throughout, no skin lesions, and your sternal features are symmetrical. Okay. Next, I'm going to go ahead and palpate some areas. I'm going to go ahead and start with the scalp. The scalp moves freely over your skull. Your hair is fine and smooth. No areas of alopecia where you have lost hair. Let me palpate facial bones. Any tenderness?
No.
No. Okay. This is your temporomandibular joint. Could you please open your mouth? Is it tender at all?
No.
No. Okay. Okay. Next, I'm going to palpate your sinuses. These are the frontal. I don't feel any swelling. Do you have tenderness?
No.
No? Okay. Next, I'm going to ask you to do some facial movements to check cranial nerve 7 and 12. All right. Can you close your eyes shut? Can you frown? Can you smile? And now clench your teeth. Can you puff out your cheeks? And, okay. Stick out your tongue. Move it from side to side and up and down. Okay. So when I'm checking all of these expressions, I'm checking, like I said, for cranial nerve 7, which is called facial, and 12 is called hypoglossal. Very good. I'm also going to test cranial nerve number 5, which is trigeminal. And for this, I'm going to ask you to close your eyes and tell me when you feel the cotton ball.
There, 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 there.
Okay, perfect. Everything is intact. Okay, next I'm going to move to your eyes. Once again, they're symmetrical. Your eyelids, your eyelashes, your eyebrows, everything is symmetrical and intact. No lesions, no drainage or anything like that. Let me look at your sclera. Open your eyes for me. Okay, your sclera is white. The conjunctiva is light pink with no areas of extra redness, which is all very, very normal. Okay, let's go ahead and check your cranial nerve number 2, which is the optic. And for this test, this is called the Rosenbaum chart. If I want you to hold it 12 inches from you and read the smallest line you can read.
428739.
Okay, great. That corresponds with 20/20 vision. Okay. Next, I'm going to check your pupils. So I'm going to shine a light. Just look straight ahead. This is direct. And then I'm going to check the consensual response on your other eye. Okay, so both of your pupils are symmetrical and round and react appropriately. Okay, next I'll keep this. I'm gonna check extraocular muscles. With this, I want you to keep your eyes focused on the pen line, and I'm gonna move it in different directions. I don't want you to move your head, just your eyes. Okay. Good. Okay, so I'm checking for cranial nerve number 3, 4, and 6. Those are the ones that control movements of the eyes. Number 3 is the oculomotor, number 4 is trochlear, and number 6 is obtuscens, and they are intact. Let's do one more test for your eyes. It's called the cover and uncover test. So for that, it's simple. Just cover one eye and just look straight ahead. Okay, uncover, and you can cover the other eye. Great, and what I'm looking for here is any abnormal movements, any strabismus, and I don't see anything. Your eyes are intact. Okay, let's go ahead and move to your ears. They're aligned and they're symmetrical. They're aligned with your eyes. They're symmetrical. No obvious lesions, no abnormalities. Okay, I'm going to palpate the auricle. Do you have any tenderness when I do this? When
No.
I tag it? Okay. All right, good. Next I'm going to do the whisper test, and I'm just going to be checking hearing. And I'm going to move behind you and whisper some words, and I want you to tell me what you hear.
Okay.
So we're going to start with the right ear. If you can go ahead and cover it. Up and down.
Up and down.
Good, good. Let's do the other one.
Black hair.
Good, okay. Good, good, good. There we go. Next I'm going to look inside of your ears with my otoscope. Okay. So the sternal canal is intact. Your tympanic membrane is also intact. Pearly gray in color, no perforation. And the same with this ear. Okay, perfect. Then I'm going to check what we call the Weber test. I'm going to strike the tuning fork and put it on top of your head. And I would like for you to tell me if you hear the vibration equally in both ears.
Yes.
Okay. And then the next test is called Rhine, and we're going to compare bone conduction with air conduction. For this, I'm going to strike the tuning fork and put it in your mastering process first. You have to tell me when you don't hear the vibration anymore, and then we'll put it next to your ear to compare. We're going to compare the time.
Okay.
Let's do the same.
Okay. Okay.
Okay, so roughly, air conduction is double the amount of time from the bone conduction, which is very normal. Next, I'm gonna move to your nose. Your nose, let me see, an inspection is midline, no obvious skin lesions, no abnormalities. Let me see, no tenderness?
No.
Okay, I will wait for you to cover one side of your nose, one nostril, and inhale. Okay, good. Now we're gonna do the other. Okay, so both of your nostrils are intact. Okay. If you can look up, I'm gonna look inside of your nose. Your mucosa is pink, no abnormalities, no lesions. Then your septum is intact, pierced midline. The turbinates are okay. They're also intact, no perforation. Okay, good. For the next part of the test, I'm gonna check your mouth. Let me get my light source handy. All right. So first, I'm going to start with your lips. Your lips are symmetrical, pink, no lesions, are intact. Okay. Open your mouth wide. All right. So your mucosa is pink, and the floor of your mouth is also pink, smooth, intact, no lesions, no abnormalities. Hard and soft palate, the same, intact, pink, no abnormalities. Your teeth are ivory in color. The contour is smooth. No cavities, just some fillings. Okay, take a break. And then I'm gonna check the back of your throat. Okay? Can you stick out your tongue for me? Okay, so, and they say ha. There we go. So when I was doing that, the gag reflex and the test, we're checking cranial nerve number 9 and number 10. Number 9 is called glossopharyngeal, and number 10 is called vagus, and both of your nerves are intact. Okay, now for the next thing I would like to do is check your tongue. Because of tongue cancer abnormalities, they usually start in the very back of your tongue in the lateral aspect. I'm going to use this gauze to really help your tongue move around so I can get a good inspection. Okay, open your mouth for me. Stick out your tongue. I'm just going to move it. I want to take a look. Yeah, okay. So I don't see any abnormalities, no lesions. Everything looks very good. Okay. Sorry, I have a tickle. Okay, now I'm going to move to the neck. Your neck is intact, it's symmetrical, no obvious bulging areas, no goiter. I'm gonna also start with palpating. Palpating your carotid first, one at a time. Okay, your carotid is very strong, regular and strong, and we call it 2+. Very good, the same over here, 2+. Now I'm gonna start with moving on to the trachea. I'm going to check that your trachea is midline, no abnormalities, and it appears good. I'm going to palpate your thyroid. Can you swallow for me? Okay, I didn't feel any nodules or anything abnormal here in your thyroid. Okay, let's do some range of motion with your neck. I would like for you to flex your neck forward. Then extend it back, then move it from side to side, first, exactly. And then ear to your shoulder, and the other side. Okay, I'm gonna do some movements as well. I would like for you to resist my okay, move to the side. Move to the side. Okay, now ear to the, okay. Very good. Okay. Now I would like for you to shrug your shoulders. And now against my resistance. Very good. By checking that, I'm checking cranial nerve 11. It's called a spinal accessory, and it's very, very intact. Next, I'm going to check your lymph nodes. I'm going to start with the pre-auricular, post-auricular, tonsillar, submandibular, submental. Any tenderness? Anything? No. Okay. This is the anterior chain, cervical chain, posterior cervical chain. This is the deep chain. Also, can I ask you at this time to remove your t-shirt? I'm going to check some areas. Okay, so the supraclavicular lymph nodes are right here. And this is the infraclavicular. Can you stand your arms out? I'm going to check your axilla. Okay, I don't feel any nodules or any abnormalities, which is very, very normal. Okay, next I'm going to inspect your upper extremities for symmetry and skin, no unusual, no lesions, nothing of that sort. Going to palpate. Anything stand there?
No.
No? Let me see your hands. Good. I'm going to check for capillary refill. It's less than 2, which is very, very normal. Do me a favor and put your fingers like this. I'm going to check for claving. Okay, it's normal. We check for claving to see if you can, it might indicate if you have any lung or heart conditions. All right, I would like to feel your pulse now, your radial pulse. Okay, they're equal bilaterally, 2+, and then your brachial. They're equal and bilateral, 2+. All right, now for the next section of the exam, I want you to swing your legs over. Excuse me. And I'm gonna evaluate your posterior chest. On inspection, I can see that it's symmetrical, no obvious skin lesions or abnormalities. Your breathing is even and unlabored. I'm going to check your thoracic configuration, which we check the anterior, posterior diameter with your transverse. And your transverse is roughly double the diameter, which is normal. Okay, for the next part of the test, I'm going to go ahead and just palpate this area, which is the costovertebral angle. And I don't feel any crepitus. I'm going to percuss. Any tenderness?
No.
Okay, perfect. Next, I'm going to put my hands down here, and I'm going to ask you to take a deep breath, and I'm checking for symmetry. Do it again. There we go. There you go. Excellent. And the expansion is symmetrical. Next, I'm going to check what we call tactile fremitus. I'm going to put my hands on your back, and I want you to say 99.
99, 99, 99, 99, 99, 99, 99.
Okay, great. So both sides are symmetrical, and I didn't feel any increase of vibration in anywhere. Next, I'm going to percuss. And what I'm hearing is resonance throughout. Okay, let me percuss from side to side now to compare. Okay, very good. Next part of the exam, I'm gonna be checking for diaphragmatic excursion. So for that, I'm gonna ask you to take a deep breath and hold it, and then I'm gonna be percussing, and I'm gonna put some markings in your back. Okay. Go ahead and take a deep breath and hold it. Okay, breathe. Okay, now take a deep breath and just blow it all out and hold it. Blow it all out and hold it. Right there. You can breathe. Take a couple of normal breaths. I'm going to check and compare with the other side. Okay, ready? Let's do it again. Take a deep breath and hold it. Breathe. Okay. So take a deep exhale and hold it. Okay. Okay, so I'm gonna just measure. It's about 4 centimeters on both sides. The right side is slightly higher, which is normal. Thank you. We're gonna proceed with auscultation. I'm just gonna listen to your lungs in several different areas. I want you to take slow and deep breaths. Okay. Very good. Just a few more, and then we'll do the lateral side of your lungs. Okay. Deep breath here. Okay, 2 more. Okay, great. Both lungs are symmetrical, breath sounds are clear. I didn't hear any extra adventition sounds, which is very, very normal. Okay, why don't you go ahead and swing your legs over towards me. Okay, so now I'm going to move to your anterior chest. I take an inspection and it's symmetrical. I don't see any skin lesions other than a couple of moles, which is normal. And your breathing is even and unlabored. I don't see any pulsations on your lips, which is good as well. It's normal. Okay. I'm going to start doing some palpation. I'm going to start with the precordium, which is the different areas of your heart. I'm just going to feel for any leads, or this is the apex area of your heart, left sternal side, and the base, and I don't feel anything abnormal. Next, I'm gonna find the point of maximum impulse, which is where the heart is felt the strongest. Okay. I feel it. I feel it. It is usually a systolic. Okay. Next part of the test, I'm going to do the same thing that I did in the back, but I'm going to palpate for tactile fremitus. So just say 99.
99, 99, 99, 99, 99, 99.
Okay. Now I'm going to percuss like I did in the back. So you can just breathe normal. And I hear resonance, which is normal. Okay, very good. Next, whoops, I'm sorry. I almost hit you. I'm going to auscultate your lungs, and then I'll move to auscultation of your heart. Deep breath, take a deep breath. Very good. So again, your breath sounds are clear. I don't hear any adventitious sounds. Now I'm going to go ahead and listen to 5 areas in your heart, but first with the diaphragm and then with the bell, so it might take me a little bit longer. Okay, so I'm going to start with your second intercostal space. To the right of the sternum, which is around the aortic valve. Second intercostal space, left border is the pulmonic. Then we go down to the third, which is Erb's point. 4th intercostal space. And then 5th intercostal space, a little more towards the clavicular line, is the mitral valve. Okay, now I'm just gonna listen with my belt. You can breathe normal. Okay, so great. I didn't hear any murmurs or any abnormal heart sounds. For the next part of the evaluation, I would like for you to lay down. I'm just gonna move your t-shirt here. Okay. We're gonna move to the abdomen. I usually like to look at the contour like this and sometimes shine a light. I don't see any bulging or any abnormalities. Your skin is symmetrical and I don't see any lesions or anything like that. No pulsations, no abnormal movements. I'm gonna go ahead and auscultate. First in the right lower. Okay, so your bowel sounds are active in all quadrants, which is normal. Next, I'm going to listen to some areas that correspond to some abdominal arteries. Okay, so just the aorta. The renal arteries, the right and the left. The iliac. And then the femoral. And I don't hear any bruits or any abnormal sounds. Okay, I'm going to proceed with light palpation. And you just tell me if you have any tenderness.
No.
No. Okay. Before I move on, let me do some percussion first, okay? Okay, I hear timpani and most of the air-filled organs, and then dullness over solid masses or any or the organs. I'm going to percuss for your liver, your liver border. I'm just going to make a mark real quick. Okay, so your liver is about 7 centimeters, which is normal. Anything from 6 to 7 is normal. I mean, 6 to 12. I'm going to percuss for your spleen. Spleen dullness is her about here, 9 to 10th. Intercostal space. Okay, now I'm going to continue with my palpation. We did the light palpation. Now I'm going to do a little bit deeper. No tenderness, no pain?
No.
No, okay. Next I'm going to try to feel for your liver. Just go ahead and take a deep breath. Let it out. Okay, so the liver borders appears soft. Okay, now I'm going to try to palpate your spleen. Take a deep breath as well. Let it out. Okay, I couldn't feel your spleen, but that's normal as well. And now we're gonna try to palpate for your kidneys. Okay. I'm gonna palpate your aorta. Any tenderness, any pain?
No.
No? Okay. Do me a favor, could you raise your head up? I'm gonna check for muscle strength. No, just raise your head so I can look at your basically looking for hernias, which I didn't see. There we go, that's better. I didn't see any. Okay, I'm gonna move down to the lower extremities. I take a look in general inspection. Extremities are symmetrical, hair distribution is symmetrical, skin is even throughout. I'm gonna feel for the temperatures. Your skin is dry and warm. I don't see any abnormalities, no tenderness anywhere.
No.
Okay, so I'm gonna feel for your pulses. Popliteal pulse right here. Okay, strong, 2+. Popliteal here. Strong, 2+. And then posterior tibialis. Good, strong, 2+, equal bilateral. And this is the dorsalis pedis, equal bilateral, bilaterally 2+. Okay. Next I'm gonna do what we call a 2-point sensation. I'm gonna touch you with this caliper, and you have to try to tell me if you feel 1 or 2 points.
Okay.
Okay? I'm gonna do your hands.
2.
Mm-hmm.
1.
Okay.
2. 1.
Okay, perfect. Okay, I'm gonna ask you to sit up for me now. And I'm gonna check reflexes. Okay. I'm gonna check for your brachial. Okay, now patellar. Okay. And then the Achilles tendon. Okay, perfect. So they are both strong and reactive. A few more things before we conclude. I'm going to check your cervical strength. So I'm going to ask you to press against my hand. Good. Now backwards. Okay, very good. And if you can stand up, I'm going to ask you to lean forward. Try to touch your toes. Okay, I'm going to be checking your spine as well. Okay. And your spine is aligned. I don't see any kyphosis or any lordosis, anything like that. Also, just one more thing. If you can walk straight, like about 5 steps and come back. I'm just checking for your gait, which is steady, and your coordination is good. Okay, Oscar, with this we conclude the examination. Thank you very much. Do you have any questions?
No.
Okay, thank you.